So welcome to our final tutorials on Krok 2 2016 booklet. Krok 2 2016 booklet. It's not that much, so we'll just finish very soon. All right. A 38-year-old, my pen, guys, sorry. A 38-year-old man's workplace is within the area of effect of ionizing radiation. During a regular checkup, medical checkups, he expresses no complaint. Blood test, erythrocyte is 4.5, hemoglobin is 80, leukocyte is 2.8, platelet is 30. Can this person continue to work with sources of ionizing radiation? The person has been exposed. We've done this before. So what's your answer, guys? Can this person continue?
Contraindicated.
Exactly. So over here, you're looking at what? Working with radioactive substances and other sources of radiation is contraindicated. Contraindicated. And again, what cells are affected the most when it comes to ionizing radiation? Who can tell me what cells? What blood cell? Let me put it that way. What blood cell? I've mentioned it before. Lympho. Thank you. Lymphocyte. This is just revision. The last part is just revision. Nothing else. It was just revision. So please, just be with me. Just revision. A maternity patient breastfeeding for 1.5 weeks has attended to a doctor. She considers the onset of a disease to be when proportional breast engorgement occurred. Okay. The glands are painful. Temperature 36.6. 36.6. Expression of milk is hindered. Guys, what's your answer? Expression of milk is hindered. So your answer is what? Thank you. So your answer is C. Breast milk is not coming. It's being hindered. So it's stagnant. All right. An 11-year-old boy complains of general weakness, fever up to 38.2, pain and swelling of the knee joint. Okay. Sensation of irregular heartbeat. 3 weeks ago, the child had a case of tonsillitis. Again, give me your differentials. Quick. Differentials.
Glomerulonephritis.
Good. What else? Come again? Endocarditis. What again? Mitral stenosis. Can you guys remember something like that?
Sorry. Yes.
So anytime you have a case of tonsillitis, these things come to your mind. So you now begin to look at the question, and of course, immediately you can answer your question as simple as that. Now there is what? Fever, weakness, knee joints, irregular heartbeat, swollen knee joints. Yes. The overlying skin and the skin of the knee joint is reddened. Local temperature is increased. Movement are limited. Heart sounds are muffled. Extra systole. Auscultation revealed apical systolic murmur that is not conducted to the left inguinal region. ESR 38, CRP, C-reactive protein, antistratolysine. What is your likely diagnosis? Definitely, this is a case of what? Acute rheumatic fever. Acute rheumatic fever, which occurs as a result of what? Post-infection of what? Tonsillitis or strep infection, basically, strep infection. So over here, you're having what? B as your answer. B is your answer. Revision. An 18-year-old woman complains of mammary gland swelling. Glands are swollen. Headaches, tearfulness, abdominal distension occurring the day before menstruation. Occurs the day before menstruation. Symptoms disappear with the beginning of the menstruation. Menstruations are regular and last 5 to 6 days with interval of 28 days. Gynecological reveals no changes in the internal organs. What is your diagnosis? These things are occurring before menstruation, then they disappear with the beginning of menstruation. So what comes to your mind? This is what? Are you guys afraid? Premenstrual syndrome. Premenstrual syndrome. Premenstrual syndrome. So this definitely talks about a woman's emotions, physical health, or behavior during certain days of the menstrual cycle, generally just before her menses. Just before her menses. All right. 24-year-old patient had been delivered to a thoracic department with chest injury, fracture of these ribs. Plan radiography shows the fluid level in the pleural cavity reaching the third rib. Puncture blood contained clots. That means there's blood, isn't it? What is the optimal treatment? I think we had a massive discussion on this one. So what are you thinking about? Whereby there is a danger to the lungs. So what do you do? Do you open up or you don't open up?
You open up.
You open up. So you do what?
Emergency thoracotomy.
Exactly. Emergency thoracotomy. Don't go and say pleural puncture. No. This is emergency thoracotomy. Why? Because the lung is in danger. It's at risk of being punctured. And of course, there's even fluid. So one way or the other, it has been punctured. So we have to preserve the rest as much as we can. A 30-year-old woman was delivered to a neurosurgical department with complaints of constant headaches, nausea, vomiting, fever, weakness of the right side limbs. Anamnesis states that 1 month ago, the patient had a surgery. 1 month ago, there was a surgery of the left-sided suppurative aortitis. Aortitis, that is ear infection, right? Then mastitis, the mastoid process. He has been undergoing treatment at the ENT. Approximately 2 weeks ago, the temperature increased. Patient developed headaches. Before I continue, who can tell me 2 or 3 complications of surgery? 2 or 3 complications of surgery. Who can tell me?
Sepsis.
Myocarditis. Okay.
Come again?
I have myocarditis.
Myocarditis. Okay, that would depend on the area in question. What else? Come on. Bleeding, of course. Guys, bleeding. Okay. Check here, but don't worry. Okay, let me check. Guys, a second. That's why. Let me show you. Guys, sorry. My alert just came in. Don't ask me what kind of alert.
You give away for us.
I said, don't ask, don't say anything. Case closed. So let's continue. Okay, good. So sepsis or bleeding can be, how do you call it? Some of the complications after surgery. So please don't always forget sepsis or bleeding, or let me just say infections. Okay, good. Now, objectively, the heart rate is 98, BP is 140/90, temperature is 38, neurological pronounced stiff neck, bilateral Kennex symptom, unsteadiness during the rheumatic maneuver. First of all, you can think of something relating to the brain, true of us. So brain problem, because signs of meningism is present. So it's a brain problem now. Now look at the CT of the brain. Good. CT of the brain revealed a 3-dimensional growth with a capsule in the left hemisphere. Make the diagnosis. So first of all, you have the differentials in your head in the sense of sepsis, and of course, sepsis can also cause what? Meningism. You know that. And you have what to call bleeding, isn't it? Now with bleeding, perhaps they are giving you more information about the bleeding, isn't it? For example, maybe they will do the CSF, they will check something for it and things like that. That will give an indication for what? For a bleeding or hemorrhagic process. And signs of anemia could be present. But over here, we could be dealing with something with what? With infection. So brain infection. So what can we look at in this question? Who can tell me? What are we looking at?
cerebral abscess.
Of course, cerebral abscess. Cerebral abscess. Don't forget, this was a what? A suppurative surgery. A suppurative surgery. Suppurative surgery. That means pus was produced. Bacterial infection was there. So please take note of that. Take note of that. So over here, we are looking at what? At A as our answer. And of course, the CT also revealed the three-dimensional growth of with a capsule in the left hemisphere can also help us with the fact that there is some focal something inside the brain, which we have to look at. But of course, we could be dealing with what? With the abscess. There's an infection. You can't just see 38.3 and all that. Increased temperature. All of it that are there. So please, don't get confused. Cerebral abscess would be the most appropriate one. Cerebral abscess. Examination of Rh negative pregnant woman. Rh negative pregnant woman at 32 weeks of gestation revealed. Before that, we've discussed something about what Rh negative women. They say when they give birth, usually the first child is normally okay. Subsequent child or the next 3 children that will be coming up could have what? Agglutination reaction. Why? Because of, problem with what? Antigen mixing and things like that. Rhesus factor mixing and things like that. But over here we have what? Negative. However, they are saying that this woman developed, the person had 32 weeks of gestation, okay. But there's 4-time rise of Rh antibody. So that means that already some soldiers are there to start working or to start causing harm. Okay, so as soon as the baby is decide to come out, those that are attacking the person, something like that. With a titer of 1:64, in the first two pregnancies, the patient had experienced antenatal fetal death due to hemolytic disease. But usually the first one is usually fine, but I don't know again why first two had a problem. Now, what is the optimal tactics? So normally what we do for this kind of patient is to what? To do a prompt delivery or an early delivery. Again, we have discussed this before, so please don't get confused. We will do what? An early delivery. And that's over here. We will consider what? A as our answer. Early delivery. I think it was in 2015 booklet, if I'm correct. 74-year-old patient visited a urologist with complaints of pain above the pubis, and inability to urinate for 8 good hours. Good. At home, he had taken antispasmodic. I think this is a question that Blessing loves so much, but I don't think Blessing is here today. This is Blessing's favorite question when it comes to these kind of questions. At home, he had taken antispasmodic and had a warm bath, but no improvement occurred. The abdomen is soft and painful above the pubis. Dullness of percussion sound is observed above the pubis. You see, Paternoski point sign is negative on both sides. What condition does the patient have? What condition? So, of course, pubic pain, cannot urinate. What do you think? What is the answer? We've talked about this before. You are looking at what? A case of acute. Exactly. Acute, because we have done it. And for a 74-year-old man, what could be the underlying cause of this acute urinary retention? What could be the underlying cause?
Could be BPH, could be cancer.
Exactly. It could be cancer of the prostate. It could be prostate infection, and so on and so forth. Exactly. So here you are looking at what? At A as your answer. A 7-year-old child became ill 2 weeks after a case of tonsillitis. Again, another bonus question for all of you. Bonus question. Again, thinking of heart pathology, thinking of what? A kidney pathology. As if I'm correct, Dr. Kalila said that previous slides. There are the following complaints. Temperature is high. Hemorrhagic rash on the extremities. Enlargement of the ankle joint. Hemoglobin is 120. Platelet is 170. ESR 30. Proteinuria is there. Cylinders are present. Erythrocytes are present. What mechanism of hemorrhagic syndrome are they talking about in this case? And I think we have discussed these things. I think even in the 2015 booklet, we discussed these things, isn't it? So we said one of the mechanism of action of tonsillitis that they form what? Immune complexes. That's why it is type 3 hypersensitivity reaction. They form what? Immune what? Complexes. So if there are hemorrhagic disturbances or syndrome, what it means is that the vessel wall will be damaged. Vessel walls are damaged. Vessel walls are damaged. And that is why we're having what? This condition happen. And this is due to what? Immune complexes. We've discussed this, guys. We've discussed this. And that's what your answer is what? Is D. Your answer is D. A 33-year-old patient has developed dyspnea during physical exertion. There is palpitation, disruption of the heart rate, swollen legs. Okay, physical exertion, palpitation. Okay. Now, in the childhood, the patient had a case. Had a case of what? Acute rheumatic what? Fever. Now, before I continue the acute rheumatic fever, what do you think perhaps might have happened 2 or 3 weeks ago? Who can tell me? 2 or 3 weeks ago, what do you think might have happened?
Tonsillitis.
Tonsillitis. Thank you. Great. It means you are capturing everything. Now, there were no further requests for medical care. Objectively, the heart rate is 92. Rhythmic. Blood pressure is 170, 110/70. Apex beat is increased. The first heart sound is increased. Triple rhythm, diastolic murmur. What is your diagnosis? When exactly? I was about to say that when Kalila was mentioning about endocarditis, remember we mentioned something about what? Mitral stenosis as a result of what? Acute rheumatic fever, or because of the strep, or because of tonsillitis. So never get confused with these kind of what? Cases. So you're having what? Mitral valve stenosis. That's why it's always good to know your differentials even before you continue with the question. It helps you to narrow your answer without thinking. A 64-year-old woman has been suffering from diabetes mellitus for the last 14 good years. This is a chronic case. Now, 3 days ago, the skin on the distal phalanx of the first toe on the left foot became cold and bluish black in color. Bluish black. Guys, who can tell me what it is? Bluish black. What does it mean? Diabetes. Foot. Neuropathy or what? Gangrene, exactly. Yes, gangrene could start happening. Now there's mild pain is observed. And the reason there's mild pain, like I think Dami said that, right? The reason there's mild pain is because of what? Neuropathy. The neurons, are not working properly. So there's mild pain. Pulse on the pedal arteries cannot be detected. You see, pulse cannot be detected. Pulse on the popliteal artery is retained. Okay. Glycemia, that means glucose is 12.4. Ultrasound scan is showing what? Stenosis of the arteries in the shin areas. There's collateral compensated blood flow. That means something is compensating to prevent what? Perhaps ischemia and things like that. Now the ankle brachial pressure index is 0.7. Foot x-ray is showing destruction of the distal phalanx of the first toe. Determine the grade of the diabetic foot according to Wegner. Determine what? The diabetic foot, the grade. So now let's look at the grade of the diabetic foot according to how Wegner system assesses ulcer. It simply means ulcer assessment, okay? It simply means ulcer assessment. So if I were you, I write it down because it's a new question. So okay, that's why I took my time. I'm taking my time to explain. Now in grade one, we call it the pre-ulcerative lesion. Pre-ulcerative lesion. What it means is that in stage 1, lesion has not actually started happening, isn't it? Or ulcer formation has not started happening. Now in grade 1, we have partial In grade 1, we have partial or full thickness ulcer. Partial or full thickness ulcer being present. In grade 2, we have a probing to tension or capsule formation. Partial, this is grade 2, right? So in grade 2, we have what? Probing to tender or capsule formation. That is grade 2. Grade 3, we have deep ulceration. That means the ulcer is now entering what? Deep ulceration. Sometimes with osteitis. That means to some point, it enters to the point that some kind of infection, maybe to the bone, started what? Occurring. Osteitis. Then we have grade 4. Grade 4 means partial foot gangrene. Partial foot gangrene. That means it's not the whole foot that is affected. It's partial, not the whole foot. That means one part or some part is affected. That's called partial foot gangrene. And guys, don't confuse yourself when I say ulcer and when I say gangrene. You know, ulcer is forming, okay? It's forming. Now, if it gets to gangrene, it's now like it's getting rotten. So get the difference. In ulcer, it means yes, ulcer is forming or it's about to get rotten. In gangrene, it has rotten. So take note of the two. Because I remember I was mentioning the grade, I was mentioning something about ulcer, and now I'm saying now there's what? Foot gangrene. That's different. Now in stage 5, we have the whole foot gangrene. And that's when we normally cut the patient's leg. And I hope you guys know that we do amputate people, right? Because of this kind of gangrene. Do you know that? Who knows that?
Yes, sir. Yes,
We do cut things like that when we're at Tally. Now the smelling is too much or the rottenness is too much. We cut it off. Otherwise, it will spread to the whole body, which is more dangerous. So yeah. So now over here, let's determine the grade based on what we have said. And over here, we are going to use, first of all, they are saying that this person is having what? A problem with what? With the distal phalanx. That's like the finger or the toe. Basically, the toe. The toe. That's the first what? Toe. The first toe. That means one, it is not the full foot that is affected. It's just the toe. The toe of the left foot, of course. The toe of the left foot is affected. And they've told you that it has become cold and bluish black. So again, this bluish black, like some of you said, this is not actually an ulcer stage. This is now what? Rotten stage. Or a gangrene has formed. Gangrene has formed. So already we know we're talking about what? Gangrene formation. So with gangrene formation, what you start thinking of is what? Is stage 4, stage 5. Stage 4 or what? Stage 5. Now, how do you differentiate between the stage 4 and stage 5? In stage 4, it is partially. In stage 5, the whole foot is affected. And again, foot x-ray is showing that there's a distraction. They've told you a distraction, meaning the thing is having no future again. The future is not there anymore. Distraction of that same toe. So guys, what grade are we looking at for? Based on what we have discussed, what grade are you looking at for? Stage what?
Grade 4.
Grade 4, exactly. Grade 4. Grade 4. We will consider grade 4. Grade 4. So guys, over here, we're looking at what? Grade 4. Your answer is D. Grade 4. This is a new question. That is why I've taken my time. All right. A 4-month-old boy has been undergoing inpatient treatment for pneumocystic pneumonia for 4 weeks. Diagnosis has been made based on clinical signs, typical X-ray presentation, presence of severe hypoxemia, positive dynamics caused by intravenous introduction of Biceptor or cotrimoxazole. Analysis states that enzyme-linked immunosorbent assay, that is ELISA test, detected antibodies to HIV in the umbilical blood. PCR, polymerase chain reaction, performed at the age of 1 month and 3 months, and also proviral DNA was also what? Detected. And when PCR is detected and things like that are detected, it shows that, guy, HIV don't come. HIV don't come. And again, to add up to it, you have to also check what? The viral load, or the CD4 what? Count. Because this HIV, they attack the CD4 a lot. And the CD4 serves as a cell-mediated cell to help us, or a cell-mediated immunity to help us, because it's from the lymphoid origin.
Is it the T helper cell? Sorry, Dr. BAHA, this one.
Yes, they are. Yes.
CD4,
now CD4 is part of T helper cells. I mean, it's a type of T helper cells. Do you get me now?
Yes.
Yes. So, but the specific we have a lot of T helper cells, but the specific one is the CD4 count when it comes to what? HIV infection. And because they have what? Attacked them, they have destroyed them. Now the CD4 count was now what? Was not be able to be measured. Viral load and the number of CD4 count was not measured. But actually, you have to measure these things. So if there are more, it means your immunity is working. If there are less, it means they've been attacked and they've been destroyed. So now your immune system cannot protect you. So over here, of course, it's just a confirmation that we're having what? HIV infection or HIV/AIDS. HIV/AIDS. All right. Who can tell me another opportunistic infection when it comes to HIV? Apart from pneumocystis.
Is it the infectious mononuclear EBV?
Okay. Yes. But do you also know that toxo is also opportunistic guy?
Sorry?
Toxoplasmosis is also an opportunistic guy when it comes to HIV. So sometimes people with HIV, sometimes they can develop toxo, which can start affecting their brains. A 35-year-old patient undergoing treatment for heart disorder in the cardiological department has developed complaints of acute sudden pain in the epigastrium, temperature rise, Bloomberg sign. Bloomberg and the abduction of the femur signs are positive. What necessitates the surgical aid in the given case? Let's assume you don't even know what this Rasdowski sign is, but they say that Bloomberg sign is positive. There's epigastric pain. First of all, with this, what comes to your mind? What sort of infection comes to your mind? Who can tell me? Oh, nobody.
Peritonitis.
Yes, or appendicitis. Yes, peritonitis, appendicitis. These guys like these things. Now, it's just a matter of time. This epigastrium area will start moving to the right iliac area. It's just a matter of time to move. It will move. After 2 hours, 3 hours, it will move. So always take note. But when they first present, it comes as epigastric pain or the umbilical area. Then before you realize, it starts moving. So signs of peritonitis, and signs of peritonitis too is an indication that you have to do surgery. Otherwise, easily, Charlie, you can just die. You can just die. So over here, strictly, just proceed to progress as a surgical disease. And I was telling you, peritonitis, as someone was saying, or appendicitis. All of these are all surgical sort of diseases. So please take note of that. So over here, quickly, we'll do what? We'll consider a surgery. All right. A 5-year-old girl was hospitalized with complaints of pain and swelling in the right knee joint. Temperature 38.4, rash, and a rash diagnosed as erythema. Erythema. What is the full word of this thing?
Annulare centrifugum.
Come again.
Annulare centrifugum.
Centrifugum. Annulare cent. Yes. Hey. Me, I'm not from an English country. Except those who have been forming the Lawrence and Co who have been forming English. Me, I know my stand. The science, I know my stand now. The science developed 3 days after recovery from an acute respiratory disease. An acute respiratory disease. Name the etiologic drug. I remember Bridget Ayonam and I was discussing something like this when we were having a one-on-one discussion. She called me, she likes calling me because she's one of my babes. So she called me and we discussed something like a question like this, something similar like this. So look at it. This person had what? Or had a case of what? Acute respiratory disease. Acute respiratory disease, which could be bacterial, could also be what? Be viral. Of course, I know mostly viral. But now we are having what? Temperature rise. Okay. Temperature rise. Knee pains or inflammation of the knee or signs of inflammation, put that way. Signs of inflammation after this case. Now the question now is that what kind of drug are you going to give? And over here, yes, there is pain. So you might think of diclofenac. No, but this person had a case of acute respiratory infection, an acute respiratory infection. And because of the analysis that is present, and now there are signs of inflammation being present, we could be looking at a case of what? A bacteria kind of infection. However, we are not too sure of the specific kind of bacteria. So what do you do if you want to give a drug for a variety of possibility of, come again?
Broad,
exactly. So you give what? A broad spectrum antibiotic. A broad spectrum antibiotic before you start thinking of what? Your pain relief medications like the diclofenac. So over here, the broad spectrum would be what? Would be amoxiclav or co-amoxiclav, also known as augmentin. Another name for augmentin is what? Co-amoxiclav. For every drug, we have what we call the trade name and then the generic name, right? Something like that. So over here, we're having what we call what? The augmentin. But augmentin is also what the same as what? Amoxiclav or co-amoxiclav. And normally, when people come with a lot of these acute rhinitis or acute bacterial rhinitis or respiratory sort of infection, general respiratory infection, apart from prescribing the normal taking of fluid and things like that, hot water and things like that, we normally have to prescribe what? Amoxiclav, just in case bacteria is the causative agent. So over here, we'll give what? The augmentin or co-amoxiclav. So in case you see co-amoxiclav, it's the same thing. During medical examination of a group of children under 4 years carried out by a pediatric team in one of the African countries, a set of similar pathological signs was detected in some of the children. The signs are as follows. There's growth inhibition, mental changes, muscle atrophy, swellings, changes in the hair, skin pigmentation. Children were diagnosed of kwashiorkor. Before I continue, what is kwashiorkor? Who can tell me? It's a popular disease. Kwashiorkor, marasmus. Marasmus. But I'm talking about kwashiorkor. Oh, nobody knows?
Lack of vitamin B.
deficiency.
Hey, I'm hearing like vitamin B or something.
Protein deficiency.
Yes, proteins. If you don't have protein, if you're having protein nutrition, you develop kwashiorkor. Yes. So this is protein malnutrition. Severe form of what? Protein malnutrition. Protein malnutrition. And if there's no enough protein, what does it mean? That there's not enough protein. What happens to oncotic pressure? Who can tell me? No enough protein. What happens to oncotic pressure?
Reduces, drops.
It's reduced oncotic pressure because proteins, you are dealing with what? Albumin. And albumin controls oncotic pressure. So when this oncotic pressure is reduced, what happens? Fluid begins to move and enter into the interstitium. And when they enter into the interstitium, what happens? Edema starts forming. Swelling of the abdomen starts forming. And that is called what? Ascites. So if you look at somebody with kwashiorkor, you wear that tale, the guy is pregnant by force. Pregnant by force, isn't it? That is kwashiorkor. So please take note. So the person is lacking what? Some protein food.
And Dr. BAHA, sorry to interrupt. Albumin holds on to water, doesn't it?
Yes. They hold on to water. And that is why we say it controls, is what you use for oncotic pressure. Oncotic pressure means the ability to hold water. That's oncotic pressure, the ability to hold water in the vessels. And it has a range which is supposed to be. So when it is too much, it is not good. When it is too low, it is not good. And that's when we talk about edema formation. A lot of things come to play. And when the oncotic pressure is too high, too much fluid gets there. What is the term we call it? Who can tell me? Oh, it's very common. Too much pressure inside the vessel is called what? Guys, anyone?
In the vessel or abdominal cavity?
No. Now there is too much of oncotic pressure, too much of proteins. So now there is too much water inside the vessels because it's holding onto the water. So inside the vessel, how do we call it when we have too much of fluid? Come again?
Hypervolemia.
Hypervolemia, or very common name.
Sure.
Hypertension. What is the meaning of hypertension? Hypertension means increased pressure. Your mind is too far. You guys are thinking too much. Don't think too much. Just come home. Too much pressure means hypertension. So depending on the mechanism, then we can now have different kinds of hypertension. Where you can have the hypovolemia, which is because of what? Water. But too much pressure in general is what? Hypertension. How can also result when there's what? Constrictions. That's another mechanism. So that one is not because there's too much what? Of oncotic pressure. It's because of what? The vessels are what? Are constricted. And again, because too much of sodium is inside the vessel. Don't forget, sodium 2 is also what? A water retaining what? Substance. Guys, are we together?
Yes.
Awesome. Don't think too far. Medicine is just close to you. Don't think too far. Some of you, when you do the Krok, you heard that you are getting some silly mistake because you are thinking too far. Nene, always thinking too far. Come home. What
Dr.
food?
Why,
I've reported you. Come home. What food product should be added to the diet to treat this disorder? Guys, even before going to the options, now you have already defined kwashiorkor. So what should you give to the person? Definitely proteins, isn't it? Right? Oh, I'm talking to myself.
Yes.
Yeah, proteins.
Exactly. You give proteins. So you now ask yourself, which one of these substances, according to the option that they are having, which one of them is more of proteins? That's all. You know that I love fish. And fish is one of the things that are very, very rich in proteins. That's why my body is always fresh. I know Uche will say otherwise, but my skin is always fresh. I don't care what it says. My skin is always fresh. You understand me? You can even ask Damilola. She will tell you. My skin is always, when she touches it, she can feel the flesh, So please, the fish is very, very important. Take the fish. And again, cereals, they are very, very, very rich. Also in proteins. Cereals are also very, very rich in proteins. But of course, vegetables are not really more of proteins. But then it's more of the balances everything together. And that's over here. If you look at the option that we are having, the most appropriate one will be what? The fish, the vegetables, and what? The cereals. Together, it is better. So it will make to balance the diet, because this person is eating a lot of carbo. And this disease is very common in people who are poor, because every day eat manka. And you are eating it, yes. They know that the child is getting sick. No meat, no fish, nothing. Always eating manka. So please stop that, Afon. Stop eating manka, okay? If you eat self, balance it. So over here we are thinking more of what? Of the fish, the vegetables, and the cereals. Okay, that will be more appropriate. That will be more appropriate to what we are looking for. An 8-year-old girl was diagnosed with signs of Mongani Adams-Stokes disease that developed against the background of third-degree atrioventricular heart block. That's more like a complete heart block. Anyways, what drug should be introduced intravenously for emergency aid? Now look at it. The heart is blocked. Now before that, before you get confused, what the Stokes-Adams is all about. This is simply an abrupt decrease in the cardiac output. Decrease in cardiac output. And of course, we can lead to loss of consciousness because blood is not entering to the brain. So again, the Stokes-Adams deals with what? Or is characterized by decrease in the cardiac output and loss of consciousness. And this could be due to what? Block of the heart or blockage in the heart, or inability for contraction to take place. And usually in a third degree, that means pumping is not even happening. So we have to look at the patient very well. So very, very crucial. So over here, that is what we are looking at. So the question now is that what drugs should we give to help the person? And usually the drug you want to consider will be the epinephrines and then the non-epinephrines. These are the drugs that you want to, because these things, Charlie, it makes all your body to begin to vibrate by force. So these are actually the recommended drug, or the initial treatment is what we use the epinephrine or the adrenaline. We can use that one. However, in the absence of these things, we can also use what we call what? Atropine. And atropine is also used to treat people with bradycardia. Is used to treat people with bradycardia. That means low heartbeat. And this person have what? A block in the heart. So low heartbeat, adequate pumping. So you give what? Atropine to increase the heartbeat, So the more it beats, the more the blood will also come out, isn't it? So we can give what? Bradycardia. So we can give bradycardia. We can give atropine. This will prevent the bradycardia. So what it means is that the patient actually have what? The bradycardia, because blood is not pumping and the heart is not pumping that well. So blood is not circulating. So we can give what? The atropine. That's over here. Your answer would be what? Will be B. Atropine. A 62-year-old man addressed a urologist with complaints of frequent urination at night, sensation of incomplete voiding of the urinary bladder, pain in the lower abdomen, slow urination, second-degree essential hypertension. Current case, second-degree enlargement of the prostate gland. Even before I was reading it, I believe people know your diagnosis already, isn't it? So prostate was enlargement, because we have already done it. PSA is 2.2. Select the drug suitable for long-term therapy for this patient. So this patient has what? Second-degree enlargement of what? Prostate gland, which is actually leading to what? The urinary retention, which is leading to the urinary retention. And actually, the drug of treatment for enlarged prostate And of course, in a way to control also the blood pressure is what we call the doxazosin. Dr.
Baha, sorry to interrupt. Is that like the finasteride?
Come again?
Is that like finasteride? Or am I confusing it?
Actually, I don't know that drug, actually. So
because that's what we give in England.
Okay. You know, England, they have sophisticated medication, but you write it for me, I'll look at it for you. Okay?
Okay, thank you.
For you. Yeah. But we give this drug to help shrink or reduce the symptoms of the enlargement. Okay. So basically, it improves BPH, basically. So people with BPH, where it has not developed into a cancer or things like that, where you might want to do, the medication that you can use is this drug. So you can use to help the patient. So the answer is what? Is A. Is A. And guys, don't forget, having a prostate, too much of the prostate is normal in every male. Every male is normal. So just pray that it doesn't cause problems for you when you grow. Okay? That's all. And anytime you have sex, PSA increases, just to let you know. So if you're going to have sex, so sometimes for us to check the PSA, we tell them not to have sex for like 3 or 4 days before they come. And they shouldn't ejaculate. Okay. Don't worry. Nene, don't worry. It's well. On the 9th day after childbirth, the obstetric patient developed high fever, complaints of pain in the right mammary gland. Pain in the right mammary gland. Already know, you know your mammary gland is. Examination revealed the following: a sharply painful infiltrate palpated at the right mammary gland. Skin over the infiltrate is red. Subareolar area and the nipple are swollen and painful. Guys, they didn't say the nipple is retracted. Uche, nipple is not retracted. Nipple is just swollen and painful. Infiltrate is there. So what is your diagnosis, guys? What's your diagnosis? Let's go. Oh, nobody knows?
Is it the serious mastitis?
It's abscess.
Yes. Yes, abscess. Infiltrate is there. Infiltrate is there. Now, when we talk about serous, serous means it's a clear, sort of fluid. But though the question is not really specific about the color, if I'm correct, the question is not specific about the color. But mostly, this is what an abscess. This is what an abscess. This is an abscess. An abscess. So I look more of what? Of C. You're looking for more of what? Of C. Of C. All right. And usually this nature, if you can recollect, the rare disease will be infiltrative purulent mastitis. Infiltrative purulent mastitis, which can lead to what? Abscess formation. If you can remember, if you guys can remember. We've done it before. 16-year-old girl addressed to a doctor, complaints of fatigability and dizziness. Auscultation revealed what? Systolic murmur in the second intercostal area along with the breastbone edge. ECG revealed signs of right ventricular hyperplasia. Guys, right, not left. Right. So start knowing where you have to go to. Now, X-rays revealing what? Dilatation of the artery trunk. So the pulmonary artery trunk. Dilatation, that means getting what? Enlarged. Then there's enlargement of the right heart. Guys, what is your disorder? Who can tell me? What is your disorder? Enlargement of the right ventricular hyperplasia, enlargement of the right heart, artery trunk is dilated or is also big. What are you thinking about?
A.
Pulmonary artery.
Of course, pulmonary artery. Pulmonary artery outflow stenosis. Outflow, because the fluid is not going into the lungs, they are now coming back. Now, this can develop into what we call, have you guys heard of cor pulmonale? Cor pulmonale.
Yes, please.
More or less like right heart failure. More or less. Right heart failure. So if you begin to go further, you realize that this person can even develop ascites or even edema in the extremities, and even the jugular vein could increase. If you go further to analyze the patient, you see all of these things present. But basically, we're having what? A pulmonary artery outflow stenosis. I mean, it's not going out into the lungs. It's not going out into the lungs. So everything is stagnant. So the artery itself will bulge. The right heart, whereby the fluid has come, will also not enter into the pulmonary trunk. So everything is there. That's what I'm saying, that it will just begin to come back like that. So we're looking at what? At pulmonary artery outflow stenosis. Outflow stenosis. A 32-year-old patient complains of excessive appetite. Excessive appetite. Okay, appetite. Excessive weight. Dyspnea during physical exertion. There are fat deposit in the area of the abdomen and the shoulder girdle. Abdomen and shoulder. Okay. Skin is pale pink. Adult male pattern of hair distribution. Male pattern of hair distribution. No stretch marks. Uche, no stretch marks is there. Heart rate is 90. Guys, I'm mentioning Uche because we had an encounter with stretch marks before. That's why I say Uche. So always remember Uche in your exams. 120, 80 is the BP. The body build index is equal to 35. If I ask you now the types of body mass index, I mean the type of obesity, you know. Sugar is 4.9, cholesterol is 6.2. On ophthalmoscopy, the eye is without changes. Guys, what are you talking about? First of all, look at it. Excessive appetite, weight gain. What are you thinking about? Oh.
Obesity.
Come again?
Obesity?
Obesity, but what type of obesity? Is it of...
alimentary.
Yeah, come again?
Alimentary?
Yes, alimentary type of what? Obesity. We've done this thing. Alimentary types of obesity. And if you look at the question here, there's no underlying cause apart from the fact that it's the eating, isn't it? And hence, we have what we call it, the primary. Primary means no other, no obvious, how do you call it? Pathology or no underlying disease that is causing it. For example, if you have a thing like maybe Cushing problem and then obesity start coming in, we could say this was a secondary kind of what? Obesity, isn't it? But of course, depending on the type of this thing, you know what it is. But because we're looking at out of what? For primary alimentary constitutive what? Obesity. And of course, the last time our friend Nene explained the Android type of to us, whereby more or less the abdomen and then the hips are more or less like enlarged and things like that. They are, I won't say us, but I've said it. All of those places. Okay.